Good evening. Today on Straight Talk with Vijay Narayan, we are out of the studios and right here at a historic occasion, of course, last week, but we are at the venue this evening with Dr. Krupali Tappoo. Dr. Krupali, of course, is part of the Sai Sanjeevani Hospital. She's the director of the hospital, the children's hospital that brings a lot of positive things for a number of our children in Fiji and the Pacific. And while the surgeries are underway, the first round of surgeries completed, we tried our very best to get Dr. Krupali to speak to you and to speak to us about the initiative, how it started, and the future as far as the Children's Hospital here in Nasese is concerned. Dr. Krupali, thank you very much.
Thank you for having me. It's such a pleasure to be talking to you today.
Yeah. Dr. Krupali, first of all, some people would know that you are associated with the Tappoo family. Some people would know you because of your medical background. But definitely you've got a story to tell about your background. If you can share with us, our viewers.
Sure. So in terms of my medical background, I guess I got into medicine because I had a grand uncle, Dr. Champa, and I think many people would be aware of him. He was an ophthalmologist, and I remember seeing him at work when I was quite young, and I always felt that he was an amazing person, and I felt that the work he was doing was making a difference to people, and I felt that I felt inspired by him, and I felt that I think medicine's a noble profession to be in. And so as I was growing up, I ended up doing all science subjects in high school as well, and I really enjoyed biology and chemistry. Physics not so much, but certainly biology and chemistry. And when I had to make a decision about what I was going to do, I think it didn't take me long. I sort of realized that I wanted to become a doctor. So it was easy in that sense. And I think that hard work is something that I was never shy of, and I knew that if I had to venture in the path of doing medicine, it was going to be hard work. But I think I was prepared for it.
So your journey in entering the medical field, of course you had some dreams and aspirations on why you joined the medical field. You can share that.
Yeah, so I think that dream really was that I wanted to be useful to society and not just be in this profession because of money or any finances, but really I wanted to make a difference in the lives of people. And so I studied medicine at the Fiji School of Medicine. At that time, that's what it was called. I actually got a scholarship because I did quite well in my Form 7 exams and Form 6 exams, and I ended up doing my medical degree. I did my internship then in 2006 at the CWM hospital. That was a very busy, hectic year, but I think it was a really good experience. And in early 2008, I actually left. I went to Australia because I felt that I wanted, to get more training. I thought I sort of moved away for greener pastures, like a lot of people do. And I worked in at the Gold Coast Hospital for some time, and then I went to Melbourne because I was doing a bridging course because you have to do medical council exams, and I did a bridging course in Melbourne, and I worked at that course for some time teaching overseas trained doctors. Then I moved to Sydney and I worked at the Westmead Hospital, and that whole there's a whole group of hospitals, the Sydney West Area Health. So I worked there for over 2 years, and while I was working there, I thought that I wanted to become a cardiologist. And in Australia, in Sydney, Concord Hospital is actually a very good hospital for physicians training. So I started working there, and after working in the hospital system, even there in Australia, which is a very progressive country, a lot of resources are available. I had a young daughter as well. My husband was always traveling for work, and when you work in the hospital, you have to do night shifts, you have to work long hours, and it was good, but I realized that that's probably not what I really wanted in my life. So then I decided to do training in general practice or family medicine and become a general practitioner. As you may be aware, in Australia, you can't just become a GP just after doing medicine, so you have to do a 3-year training program. So I did that, and for that, because I did my initial degree overseas, I had to go to 2 different country towns. So I lived in Muswellbrook, which is up of Hunter Valley. People might be familiar with Hunter Valley, which is a wine country town in New South Wales. So I worked there for a year. I worked in Foster, which is another country town. It's an hour from Newcastle, another very beautiful town, white sandy beaches, and a beautiful practice that I worked in. And I think those were really amazing times. I had a wonderful experience. And when I worked in Sydney, I worked in a lot of different specialties, so I worked in pediatrics, in obs and gynae. I also did some cardiology, respiratory medicine, renal, endocrine, psychiatry, emergency medicine. So a whole variety of things which, on reflection, I think it was amazing, because I think it's given me the experience that I have now, and I think that shaped me as a clinician. And when you are a GP or a general practitioner, you're looking after, little bit from little babies to the geriatric patients, and you're not just dealing with one aspect of medicine. You're looking at, I also look after pregnant women, so I do shared care with, obs and gynae specialists. I also did a diploma in child health, so I see a lot of children, lots of immunizations, well baby checks. I really enjoy women's health, and I did more training in women's health as well in Australia. So mental health is another area that I'm interested in, and so I think all of those experiences have shaped me as a clinician. And to be honest, my initial plan was to stay on in Australia and work there. And at some point I planned that I would be a partner in a large practice in Sydney. So that was a plan that I had for myself. But in 2015, my grandmother passed away. And I think I was reflecting on what life was all about. And I thought, are we just here to exist, or are we here for a greater purpose in life? And I really thought to myself how I could make a difference. And what happened at that point was this foundation, Zikrama Foundation, was sort of in the making. It hadn't been established as an NGO at that time, but the foundation was sort of being laid, that there was going to be a foundation. And a few of our family members were sort of, involved in this. And the thought was that there was going to be a bit of medical work happening, and that it would be good to have a doctor who might be there, who could lead this. And so it was sort of put out across to me as, this is an opportunity. And I thought to myself, okay, I think it's an opportunity. This is something that I may be able to contribute towards the country as well. And I thought to myself, if it doesn't work out, look, I still have other options. But I think when I came back to Fiji in 2016, I sort of realized that the difference that I could make. So I work in the private setting as well. I joined Dr. Rosemary Mitchell initially in her clinic, and then in 2018 I took over her clinic, but we still continue to work together. And I've had a journey in the private sector as well. So now I'm on the UN panel as a physician. I also do immigration medicals for the US and New Zealand, and I have a very good, a great practice, I would say, in terms of, my clinical work that I do is mostly through my clinic. But also I had the opportunity in 2019, Fiji National University was starting a program on family medicine. And so some of the colleagues who were here educators were here from James Cook University in Townsville, and they were looking for someone who could join them to teach, because you need the appropriate qualifications. And I did my fellowship in general practice in Australia. So I said to them, well, I could do a part-time role. So I'm involved in some teaching as well in the diploma and the master's program in family medicine. But I have to say that the work that I'm doing with Zikrama Foundation truly is incredible, also because I volunteer my time. All the work that I do with the foundation, it's not a paid role, but I think it gives me great joy to be a part of this foundation and to be able to contribute positively towards the health of people, because one of our key initiatives are we're doing social care, Medicare and Edicare in terms of the initiatives. And So we have a few medical initiatives, as you might know. We have a medical center, our Sanjeevani Medical Center, which is a general medical center providing free providing free treatments, consultations for all patients. We have a children's heart screening center where we do free echoes. And of course, now we're talking about the hospital, which, the doors have opened, and it just gives me so much joy to see that we're actually operating on children with congenital heart disease.
Yes, I mean, that is an amazing thing that we're now hearing of children who had been waiting, or no hope was left for them. Yes. And that hope has arrived, and it's reality at play here. Now, just in relation to you moving into knowing that, okay, you went for greener pastures, and then you decided, okay, I have to come back to Fiji and give back to Fiji. Now, giving back to Fiji, if you can just discuss about what is Zikrama Foundation about.
So Zikrama Foundation really is a non-governmental organization, and we were founded in 2016. And really, the aim of this foundation is to really make a difference to the lives of ordinary Fijians through, sort of medical, social care, and educare sort of initiatives. So really, the aims of the foundation are to make a positive difference in the lives of our fellow Fijians. And I think that as a foundation, in the 5 years, so much has been accomplished. Even we are amazed because we started off very, very small. There were very few members, in the foundation, and we thought we were just out there to do some good work. But along the way, things, expanded quite exponentially, and it's quite a wonder even to us as to how this all happened. But I think when you want to do some good work, the universe conspires with you, and things just fall into place. So I think that some amazing work has happened in the space of healthcare. We also do, disaster relief during cyclones, and we were involved with the Tonga, from food distribution during Tonga eruptions as well. We also do blood drives, our Be a Hero blood drive, so we've been the highest blood collector for 3 years. We have a food distribution program. We've done over 1.4 million meals. And so a lot has happened. We have many, many partners and other NGOs that we work with. So I would say in the last 5 years, a lot has happened. And in fact, Vijay, to be honest, I thought to myself when I moved from Australia that I would have a lot more time for myself when I came to Fiji, because I thought it'd be a little more laid back. I'm not going to be as busy. But I have to say, I'm even busier than I was, especially trying to do a few different roles that I have. But I have to say that it's been such a privilege and an honor to be involved in the work of Zikrama Foundation. I think it's truly, I feel blessed that I was given this opportunity. A lot of work is happening in India as well, in the Sanjeevani hospitals, and they're of the same model, free treatment for children with congenital heart disease. And really, they're our inspiration, because in 2015, the chairman of the Sanjeevani hospitals in India, Mr. C. Srinivas, had come to Fiji. And at that time, I was still living in Australia, but I'd come for a visit. And he was talking about the burden of congenital heart disease in India. And then we started discussing, with regards to Fiji. And I actually said to him, I remember as a medical student and an intern, actually seeing babies die of congenital heart disease, being in heart failure, because we didn't have the treatment, we didn't have the facilities. Very few children could go overseas, and there were very few visiting teams as well. And it was heartbreaking, Vijay, it was very painful as a young doctor to see, babies dying. And so we started discussing, and he said, oh, well, we can help. And what happened was that in 2016, August, he sent a team from Sanjeevani hospitals in India, and we had some other members some other medical professionals from Australia and Oman who'd come together. So we did the first lot of surgeries at the CWM hospital, and that was really amazing and incredible. And what I found really fulfilling was that I was involved in the planning, I used to go to all the meetings at the CWM hospital because there was a cardiac task force. And so from the foundation end, we didn't have any other medical professionals. So, that was something that I was really actively involved in, discussing with a surgeon in India and all the other sort of medical professionals. So that was incredibly, I think that was great. And so we had a visit in 2016, and then we had a team in 2018, and again in 2019. And what we realized was that, we realized that the burden of congenital heart disease was actually quite high in Fiji and the Pacific Island countries. And doing a trip a year probably wasn't doing enough justice to the cause. And we realized that we needed a local solution. We needed a sort of a solution for the Pacific. And so that idea then sort of started that what if we had a hospital which was fully equipped to do these surgeries? Because what was happening at the CWM hospital was that a lot of equipment had to be flown in. There were some other visiting teams that were coming, and they would have to bring container loads of things. So we thought to make it easier to have a place where all of this work could be done, this idea of the Sanjeevani hospital in Fiji came about. And truly, I think that the support we received from Sanjeevani hospitals in India gave us the confidence that we could do this.
It's very interesting about how a discussion and your experiences at the hospital when you saw those and witnessed those sad cases, those children dying in facilities not ready to help save lives, and eventually through that experience you are now trying to make a difference. Now I know that also the foundation and the hospital, even before the opening, you had started doing free tests.
Yes.
And I want to talk to you about that because many children and their parents do not know if the children have rheumatic heart disease or congenital heart disease. If we can talk about that, how you discovered these cases.
Sure. So when we look at heart disease in children, Vijay, it's very different to heart disease in adults. So in children, you can have a congenital heart defect where a child is born with a defect or a lesion or a hole in their heart. So it could be a hole in the top chambers of the heart, and we call that an atrial septal defect, or a hole in the bottom chambers of the heart, which is called a ventricular septal defect. You can also have, some abnormalities where there are 4 different issues with the heart. So it's called tetralogy of Fallot. You can have issues with the valves. You can have issues with switching of the positions of the blood vessels. So there are over 200 different congenital cardiac defects that you can have in children. And now in terms of how you know about them, so some defects can be so critical that a child or baby will be born and they'll be blue, or they'll be struggling to breathe. You check their oxygen levels and their oxygen levels will be low, or they'll be working really hard to breathe. You can see their chest pounding. So those ones are really critical, and with those children, if you did an echo or a scan of the heart, you'd see that they've got a defect and they would need urgent surgery to survive. Some children will have lesions that are not so critical, but they still need some attention, and they probably will need surgical intervention in the first year of life or the first few years of life. And some of the things that parents can look out for, so if you're feeding your baby, whether it's bottle feeding or breastfeeding, and they're really sweaty, or if they appear short of breath, if they're swelling around the eyes or the tummy or the feet, or if these children are not growing well, they're not gaining weight, they're looking blue, cyanosis of the lips, the fingers. Some of those are really crucial or critical sort of symptoms and signs of congenital heart disease. Some defects will be very mild and you won't even know that a child's got this, but at some point in their lives they could even collapse and die because they've got this lesion and you wouldn't really know. So congenital heart disease is something that you're born with, and very often surgical interventions what will help the child. And these days you've got the surgical intervention through open heart surgery, or you also have catheter procedures where some of the defects, you could do an angiogram. The interventional cardiologist do an angiogram, and then they put in small devices so you don't have to open up the chest. So that's really when you look at congenital heart disease, that's the pathway that you normally have, a surgical pathway. Some holes are small, they're going to close up, so you do a scan of the heart and you see this hole, and the cardiologists, the pediatricians decide, there's certain values that they look at. Some of these kids will just, the hole will close spontaneously, it doesn't need any intervention, but over half of most of these children will need some surgical intervention. So that's congenital heart disease, and for Sanjeevani Hospital here, that's the focus, is to provide, surgeries, free surgeries and treatment for children with congenital heart disease. Rheumatic heart disease is different. Rheumatic heart disease is something that you acquire. So if, say, a child has a sore throat, they have an infection with a bacteria called group A beta hemolytic strep. What happens is that the bacteria, it produces some antibodies, it can cross-react with the valves in the heart, and that can cause damage to the heart valves. And these children can end up with rheumatic fever and then rheumatic heart disease where there's valve damage. And that's different, you don't usually have surgical intervention. With those children, they would need an echo to diagnose this. And then they would need to have 3 weekly or 4 weekly monthly penicillin injections. Also for those children, oral care, hygiene is really important because oral health and heart health are linked very closely. In Fiji, we definitely have very high rates of congenital heart disease, also very high rates of rheumatic heart disease. And I know that in the last sort of 15 to 20 years, a lot of work has happened in the space of rheumatic heart disease. A lot of projects have been run, funding has been, secured so that, the projects are running. Congenital heart, defects, I guess we didn't really have a solution. So not a lot of conversations were happening. And of course, in the past few years, we've been creating awareness as well about what it is and what can be done. And it's really nice that now we actually have a hospital and a facility that can help these children. So it's okay to diagnose something, but if you have no solution, that's tricky, isn't it?
That's right. So you have, and I've seen that some of the free tests that you've conducted here prior to the hospital opening. How do you deal with the parents when they get the news, okay, they have this heart defect, congenital or rheumatic heart disease? I think you've done hundreds of tests in villages and settlements so far. If you can share some of the percentages and figures that you received from the data you got.
It's been great, Vijay, that we've got data now, that we've got a screening center, a children's heart screening center, and we're doing screening in the rural areas now with our Health on Wheels medical camps. And in our Sanjeevani Children's Heart Screening Center, we look, World Health Organization, WHO, says that about 1% of all children born are born with congenital heart disease. But the preliminary data that we're looking at looks as if it could almost be about 3% in our population. And we have about a list of about 500 children with heart disease, and almost 300 of those children have congenital heart disease. Not all of them need surgery, but many of them need surgery. So we are looking at large number of children who actually have these lesions. Often parents are quite shocked. It can be scary because, if you're told your child has a defect or a lesion or a hole in the heart, and that if they didn't get treatment, they could possibly die. I think as a parent, so I have a 3-year-old and a 13-year-old. I think that would be devastating news for any parent. And so quite often parents are shocked, they're surprised, they're worried. But I think in our screening center, we have some very good medical professionals who are handling the parents, who are having discussions with the parents and providing counseling as well and telling them the options. And we're very fortunate right now that we have our visiting team and they're operating on children. It was quite sad over the COVID period with the border closures. Look, no medical team or surgical team could come in, and we lost a lot of children. We've lost over a dozen children to congenital heart disease. Very painful, very sad, but something that was beyond, the control of anyone. So we're grateful that the borders have opened and that we can help these children. But Vijay, the other part of this is that we also need to train our local medical professionals, our doctors, our nurses, because the vision of this hospital is that, within the next 3 to 5 years, we want to have our own local doctors and nurses doing all these procedures. Of course, it's a very specialized area. It requires a lot of years of training. But that's the vision, for the hospital to emerge and be the most important pediatric cardiac center in Fiji and the Pacific. So, this hospital is not just for Fiji, but it's for the South Pacific Island countries. I mean, you may be aware, Fiji is one of the most developed islands in this area. And so I think we're fortunate that we may be able to assist our neighbors. In fact, we sign an MOU with the Pacific community, the SPC, and very soon we'll embark on a screening program in the Pacific Island countries as well. And we hope that when we celebrate our first year anniversary, we'll actually have operators of the children from the other nearby Pacific Islands. So of course, we're getting data from our Children's Heart Screening Center. Also, when we're out in the villages and our medical professionals are screening, I mean, we're seeing high rates of both congenital and rheumatic heart disease. And sometimes these children are symptomatic. You can see they're cyanosed, they're blue, or they're breathing fast. And you talk to the parents and they say, oh no, she's been like this. And you think, well, hang on, this child is 10. Was this not picked up earlier? So I think the other part of this is to educate our medical professionals as well about the signs and symptoms, and early detection is really crucial. So it's really, your goal would be to try and diagnose children. The earlier the better. But we're even seeing children who are 12, 13, 14 who are now being operated and they've been diagnosed very recently. So we do have a backlog of children, and I think once we screen even further out in the rural communities and in the islands, even in our outer islands, I think that we will see a huge number of cases. So we're probably just seeing the tip of the iceberg. And in the future, we would like to do a school program as well, maybe even a preschool program where all those kids can have screening. We also have a device called a HD steth. The inventor, Mr. Arvind Tyagarajan, he's from the US and he's a scientist, and he was here recently, and so he's created this device which is basically a stethoscope, and you use it as a stethoscope, but you can visualize the murmur and you can see if there's an abnormal sound, and you can even do an ECG, and so it's a really good tool for quick screening, and we use it in our Health on Wheels rural outreach camps. And so you can do a quick screening, and then if you're worried, then these children need an actual echo or a scan of the heart, which is a bit more specialized. You need doctors who are trained to do it. And Dr. Marianne Korai, and we also have Dr. James Otto, who come to our screening center and do the echoes. And to be honest, I've been so inspired watching these surgeries recently that I thought to myself that I need to educate myself even more, and I'm interested in even learning how to do echoes. So that's another thing that I'm planning on doing. But it's been an amazing journey, actually.
Now, knowing that there's always been an issue with backlogs, and unfortunately some children, the time is not on their side, and they have sadly passed away, but you've started doing surgeries from the past few days. How's that been?
Oh, it's been truly remarkable. We inaugurated the hospital on the 27th of April, and on the 30th of April we started the surgeries. We have an amazing team of medical professionals who are here, led by Dr. Sean Sethi, who is a cardiac surgeon from the United States. He's actually an adult and a pediatric surgeon, and he deals with all sorts of congenital heart defects. He's come with quite a few medical professionals from the US. Some of them work at Stanford. He works at the Miller Children's Hospital, and some of his colleagues from his hospital are here. We also have some nurses from Australia. We have a doctor from Oman. So we have about 18-member team that have come, and 2 biomedical professionals as well from the US. So you realize that you need a very specialized team to operate on these children, and certainly the surgeries that have taken place. I mean, on the first day we had 3 surgeries, 2 of which were open heart surgeries, when they actually have to open up the chest. And then we've, so far, I mean, this is day 6 of surgeries, and we're up to 20 children today, and it's been amazing. We've already discharged, I'd say, 11 children. So it's a very quick turnaround time as well. These children recover so quickly. And this team, not all the members have work in the same workplace, but they're working so well as a team that you think that they work together on a daily basis. So you've got different areas that they work in. So you've got the surgical team, which is in the operating theatre. You have the surgeon, of course. Then you've got the surgical assistant. You have a scrub nurse, a scout nurse, and then you've got a CSSD team that sterilize all the instruments, which is very important, of course, for infection control. You have the anaesthetist who puts the child to sleep. You have the intensivist in the intensive care, a specialist who looks after all those children. And then you have all your nurses, who are in the intensive care unit as well. And what we've done is that we have this visiting team, but we also have some of the local nurses and doctors from CWM Hospital and some from Limbasa as well, who are attached with this team so that they can watch and learn and pick up skills. So transfer of skills is so important. And this team that's led by Dr. Sean Sethi are very interested in teaching and training. Many of them are educators, nurse educators, or even in theatre. Dr. Sean, there's a surgeon who's been attached. So Dr. Sean's been doing a lot of teaching, and so has the anaesthetist, Dr. Ranga, Dr. Scott Stenquist. They're all, amazing team that are just working incredibly hard, and it's long hours. Some surgeries will take up to 3 to 4 hours, and they're starting early in the morning. They're here before 7, and some days they're here till 7. They're volunteering their time, Vijay. They're not getting paid to do this. They've taken time off their busy schedules in their country because they care about our children. And it's so nice to see that we're getting support from these health professionals from so many other countries. And for this inauguration, Vijay, we had over 200 people come from all around the world, some of whom have supported us. As you know, with this hospital, it's a $25 million project. We didn't receive any funding from any of the international aid agencies. This was really philanthropists from around the world who felt for the cause and who supported us. And to be really honest, when you look at the results, at the end of the day, it's just incredible to see the smiles on the faces of these parents and these children who've been given a new gift of life. Some of them had no hope, absolutely no hope. They couldn't travel overseas. It costs over $100,000, and many parents just can't afford it. Today we had a child who had a pacemaker inserted as well. So he's got a complete heart block, so his heart rate's very low, and when that happens, kids can be dizzy. They can't be like normal children, and so we were really grateful that this team is here, and also there was a team from New Zealand, a pacemaker team that are doing pacemaker checks. So there was a technician who happened to be here at the same time, so we were able to do this. So I think it's been an incredible time for all of us, and I've taken time off my job as well because it's a new hospital. We want to make sure we support the team fully, and we're here. And we have a very small team, and there's a few of us from the foundation who've been here from morning till evening, making sure that they're all okay, organizing transport for the team, making sure they're fed. So we've actually got a chef in the kitchen who's cooking for the children and the parents. So we're providing meals to the parents and the children, but also feeding all the staff, the local staff and the international team as well. They have to be fed. We've provided them with scrubs. I think it's been incredible. It's been challenging, but it's been an amazing experience. Of course, these surgeries are very specialized, so there's a lot of procurement that needs to happen, consumables, medications, and so basically I've worked with one of our other members of the foundation, Namrata, who's a pharmacist, and the two of us have worked with our surgeon and our anaesthetist, and a perfusionist, and worked on all the procurement. So it can be challenging because these things are not available locally and they can be a long lead time. But we managed to secure all the items, and the result is that we've got some fantastic results. These 20 children have already been operated on. We started on the 30th of April. The last operating day is going to be the 8th of May. and we're hoping that we can help about 30 children in this trip, and that's a big number. That's a lot of children.
Those are beautiful stories for these children and their parents.
Oh, yes.
When we finally finish at least the first round of surgeries, I wanted to ask you, $25 million, people are driving past this place, they've watched it on television, watched it online. It's an amazing dream. $25 million just can't drop out of the sky, and you have this state-of-the-art children's hospital for the children of the Pacific. How does it feel?
Oh, look, it's a very humbling feeling, I'll be honest, Vijay. It's a dream that has become a reality, you know, and it's, I'd say it's a really amazing feeling. I think that when we started off, it really was a dream, and we thought, okay, within the next 10 years, we'll achieve this dream. But, you know, quickly we realized that we couldn't wait for that long because we were losing children. You know, this hospital really is prayers of thousands of parents, of lots of mothers who've lost their children, and so we felt that we couldn't keep waiting. And the fact that this hospital is now open, and the fact that we're operating, you know, means a lot. And yes, it is a dream, but it's become a reality. And I think as a foundation, we just feel so grateful and fortunate and humbled. And we're grateful to all the people who supported this very noble initiative, because it's not an easy task, and constructing through COVID has had its challenges.
Your husband plays a big part in all of this, Sumit, and I was talking to him when I came I was privileged to be taken around before the hospital opened, but he shared his story, which really touched all of us who were in the room when he said he had gone to visit some children at the children's ward at CWM Hospital.
Yes.
And he said that sort of changed his life when he spoke to the parents. If you can share, I mean, if you don't mind, share with our viewers about you two as a couple, thinking about that moment and then saying we have to save our children.
Yeah, so, I mean, I still remember that because Sumit was away. He was in India, and then he came, and I said, okay, so you're going to come to the hospital with me. You're gonna present a certificate. So when these children used to get discharged, we give them a gift of life certificate, and we give them some gifts. So he was presenting this certificate and gift to the child, and this it was a 2-year-old child who had surgery and was going to go home, and the mother, you know, he said, oh, so how are you, and you know, and this mother just sort of, you know, broke down, and she said that, oh, Jesus has answered my prayers, and she started weeping, and we were amazed as to what was happening, that there was certainly a story behind this. And what she said really did change our lives, because she said, look, I'm a single parent, I'm a single mother, you know, I earn $5,000 a year, and my child, you know, was diagnosed with congenital heart disease, and I was told that my child needs surgery, and she said that I was told that, you know, I had to take my child overseas, it would cost more than $100,000. And she said, I tried fundraising and I raised maybe a few $1,000s, but that was it. And she said, I couldn't do any more. And she said that she resigned to the fact that, you know, her child was going to die. So she went back to her village, waiting to spend every living moment with her child, you know, just waiting for her child to die. And so when this opportunity arose and her child, you know, got the opportunity to have the surgery, the free surgery at that time, I think she just felt that Jesus had answered her prayers, because she had no hope. And you know, and that's the moment when we realize that we can't wait for 5 years or 10 years. This cannot happen. I mean, we can't have this happen in our country. And so I think we sort of made the resolve that we couldn't keep waiting. I mean, we have young children, you know, and we thought, you know, if we were that parent, how would we feel? You know, it would be so painful. And so we thought that we had to move fast. We had to do something, and we couldn't keep waiting. And it has changed our lives, because Vijay, through the last 3 years, you know, from 2019 when we started construction and the project, you know, we have been so busy that we haven't really been thinking about ourselves. I would say we've both become more selfless, because we feel that, you know, this is a responsibility that we have. Sumit was really involved, very heavily involved, in leading the construction team basically. And my role was not so much of construction, but really the medical aspects of it. And so we both had a role, and we realized that, we had to do what it took to get here. And of course, we're supported by members of our foundation, and many of them have worked very hard. And we're a very small team. There's only about 15 of us, and there are a few other, we all have children, and that's really about it. And it really, in terms of the younger people in the foundation, we've about 6 of us. And we have basically worked day and night. Many of our other members have normal jobs as well, and so people have worked around the clock, done your normal job, and then after hours you're working. But I'll tell you, Vijay, I think when you're passionate about the cause, you don't think about, what the time is or what it is. I mean, we have young children. We have a 13 and a 3-year-old. We haven't spent that much time with our children because we felt that we had to give all of us, we had to just push ourselves to get this through. But it's been challenging, but it's been, I would say, a great blessing and a great opportunity that Sumit and I could be involved in a project of this magnitude. And we are so grateful to, our inspiration, is Sathya Sai Baba, and his principles are, basically love all, serve all. And our mentor, Sadhguru Sri Madhusudan Sai, who's sort of leading into the footsteps of Sai Baba, also has the same principles, and that we love all and we serve all, and that we are all one, we're one global community. And, if we're all one, we have to help each other. And, so any other child, that child belongs to all of us. And it's our responsibility to make sure that they're all okay. So I'd say that it's been a real journey, but it's been an incredible journey. And I think we've transformed as individuals and as human beings as well. I mean, it's been challenging. We've shed many tears. We've had many ups and downs. But if you talk to any member of our team, they'll still be smiling and say that this was all worth it. All those smiles on these children's faces, it's worth it. All these parents, when we're discharging parents, we're giving their children, some gifts. And often I ask them, were you okay? Were you comfortable? You can give us some feedback if there's anything that we can improve on. And you know what they've said to us? They've said, it's such an incredible facility, and they said, we felt like we were in a hotel. We were given very good food. The nurses, the doctors, they all cared about us. They were also given, there's a chair in the ward. So one parent has been staying with a child. All COVID protocols followed. People not allowed to come in without a COVID test and masks and all of that, all the protocols in place. And this parent, one parent can stay with the child. So they're in a chair which becomes a bed at night. So they're actually comfortable. They've got pillow, they've got blankets, they've got all their beddings. There's showers for them, that they can have a hot shower. These children are given 6 meals a day: breakfast, morning tea, lunch, afternoon tea, dinner, supper, and the parents are also given all those meals. We had a dietitian who worked on designing the menu, but I also made some changes. And I'll tell you, like, every aspect of the hospital, the laundry, the kitchen, the wards, the theatre that we've been involved in. So it's like a child, it's like a baby, and you feel like this, child has we've given birth, and now, early days, and slowly we'll see this child grow up. And that's the story of Sanjeevani. And Sanjeevani means like elixir of life, gift of life. And when you look at that big heart outside, it's quite, I think that it sort of reflects on what this hospital means. Of course, we're operating on children with heart disease, but it's also about transformation of the human heart. And really, we've seen parents walking out the door and saying, how they feel so inspired, and that they want to help other parents, and they want to, do something so that they can make a difference to the lives of others. And so, this hospital is not just a hospital. I feel that it's like a temple of healing. And some of what these parents and even these children have said, it's just been so inspiring, and it's even brought tears in our eyes, because we felt that, we've achieved something. And of course, there's always room for improvement, and that's why with all the parents we ask them, you can tell us what else we can do to make, your stay more comfortable. And they say, oh no, we are so grateful, we are so happy to be here. And there's no billing counter, Vijay, so they're not paying anything. It's all free. All the surgeries, the treatments, everything is free. So, I don't think you can get any better than that.
My final question before we take our viewers on a tour, thank you very much for agreeing to that. But you have definitely got an immediate plan, you have a medium-term plan and a long-term plan. You highlighted backlogs, you highlighted the need to test more, screen more to find the true impact of what you're dealing with, and you need more locals to get trained so that they get into the field, and that would sort of take off a bit of burden. At the moment you may have majority of your volunteers all from abroad, but we need to look at that. So if you can just tell people how will that be progressing.
So what we're planning, we've got a surgical trip right now. We're hoping that we'll have our Sanjeevani team come from India, hopefully in June, and we'll do another lot of surgeries. And at that time, we'll have the cath lab become operational as well, so they can do catheter procedures. And we're hoping that at least for the next year, every 2 months, we can have a team come, so we can work on the backlogs, we can work on operating on the children, and we're also hoping that in the next few months we can actually go out in the Pacific Islands and start screening so that we can have some of those children come here and we can operate on those children as well. So that's the sort of plan for the next 1 year. And at the moment, and with all the surgical visits, we'll have these local doctors and nurses attached. So we're also providing them with some training. And the eventual plan is to send our local medical professionals to our sister hospital in India, Sanjeevani, who are willing to provide free, training, free meals, free accommodations for our local medical professionals. And, in the next sort of 3 to 5 years, we hope that we can have a local team. It's an ambitious, it's not going to be easy, but it requires a lot of effort. But really, so for now, we're hoping every second month we can have a surgical trip, and hopefully after a year, every month we can have a team coming. And we've got teams lined up from Singapore, Malaysia, even the US, and possibly the UK as well. And we're actually working with a global network of people. We had over 200 people come from around the world. And those people are also so inspired to see all that they can do, go back to their country and talk to their friends and see how they can support us, and for them to also bring teams. So certainly we know that for the next few years we do have to depend on visiting teams, but we work on training our locals, and we will eventually get there.
Dr. Krupali, thank you very much. We'll take our viewers on a tour after this. Thank you for all your work that you've done. Thank you for coming back to Fiji and deciding to stay on to see this great project come to life. And let's see how this project is in its existence at the moment and going forward. So thank you very much.
Thank you for having me. It was a pleasure talking to you.
Thank you.
All right, so we're just going for the parents and children, and also our medical. And you can see all the bench tops, the stainless steel counters, easy to clean, all the different, there's a good workflow, and it's free in the evening. We've got one person that's attached to the laundry, one is not operational at the moment, but we will do. You can see that you need a lot of different medications and consumables. A pharmacist attached here with us from the hospital. So we're, washing all the scrubs, washing all the hospital linen. We have one staff from CWM Hospital who's assisting, and we have another staff that has been also, this laundry was designed and sort of procured from New Zealand. And I think it's working really well. They're working incredibly hard their surgery and make sure that everything's done for them before they actually have their surgery the next day. the operating theatre. Dr. Ranga, who's the anaesthetist at the head of the bed, he actually works in Oman. So they don't actually work together on a daily basis. They're all, from different parts of the world or different states in the US as well. To Rotary for assisting us with this. I tell, our fellow Fijians, to all those who've supported us, thank you for your support. To all the parents out there, if you're worried about your child, don't hesitate to, bring your child in for a checkup. Our screening center provides free screenings, or you visit your nearest health center and you can get referred here. I'd say don't wait. This is something that, if it's early detection, saves lives, and I think it applies to congenital heart disease as well. And I think that if you, Sanjeevani Hospital is really here for all of you, and it's free. And we want to help Fiji and the Pacific Island countries. So to all our fellow Fijians out there, this hospital is for all of you.